So, very good day to one and all. I'm Dr. Rohit Gopinath, and today I'll be talking about a very important topic, venous diseases, concentrating specifically on the lower limbs. Now, venous diseases, especially of those of the lower limb, are extremely important because they are encountered in surgical practice on a day-to-day basis. So, before we go on to the pathologies involving the veins of the lower limbs particularly, it is very much essential that we have a basic understanding regarding the anatomy of the veins of the lower limb. So the veins of the lower limb, three in types we can say. So one are a group of veins called the deep veins. So deep veins are also called veins of conduit. They are called so because they carry the major amount of blood and enter into the systemic circulation, that is into the inferior vena cava. So veins of conduit are mainly the tibial vein, the popliteal vein, femoral vein, which in turn proceeds on into the external iliac vein, common iliac vein, and into the IVC. So the veins of conduit or deep veins of the lower limb are called veins of conduit, and it includes the tibial vein, popliteal, and the femoral veins. Along with these, you have certain veins which are called pumping veins. So these pumping veins are basically sinusoids or small veins which are located within the muscles of the calf. So these veins which are located within the muscles of the calf constitute what are called as the musculovenous pumps, also called as the peripheral heart. They are mainly located within the gastrocnemius and soleus. Superficial veins include the long saphenous vein, the short saphenous vein, the posterior arch vein of Leonardo, and the anterior arch vein. So this is a diagrammatic representation of the venous drainage of the lower limb. So you have the posterior tibial, anterior tibial vein, which corresponds to their corresponding arteries. So they form the popliteal vein, which forms the femoral vein, and then it extends upwards as the external iliac vein. So to these deep veins, you have these superficial veins entering. So common superficial veins, like I told you, are the long saphenous vein, you have the short saphenous vein, along with that you have the posterior arch vein of Leonardo and the anterior arch vein. So it is very essential that we have a basic understanding regarding the anatomical landmarks which depict the course of these superficial veins. And the most important superficial vein of the lower limb is the great saphenous vein. It is invariably the longest vein or longest superficial vein in the body. It extends from the medial aspect of the dorsal venous arch of foot and then upwards anterior to the medial malleoli. It extends on the anteromedial aspect of the leg, goes posteriorly behind the knee joint, then again courses anteriorly onto the anteromedial aspect of the thigh, ascends up, and then it enters into the femoral vein, or it drains into the femoral vein by penetrating the deep fascia or cribriform fascia as it's called. By penetrating it, it enters and drains into the femoral vein. So you find that this area where it drains into the femoral vein is called the saphenofemoral junction. And this saphenofemoral junction is located around 3.5 centimeters below and lateral to the pubic tubercle. So all these landmarks are very important because they are necessary to identify the vein, not only to get an IV access, but also in the treatment of varicose veins. So this is the course of a great saphenous vein. Short saphenous vein has a more variable course. So you find that the short saphenous vein originates from the lateral aspect of the foot. The lateral marginal vein continues upwards as the small saphenous vein. It extends upwards along the posterior aspect of the leg, and then as it comes up into the popliteal fossa, it penetrates the deep fascia and drains into the popliteal vein. Now this saphenopopliteal junction, or where the short saphenous vein drains into the popliteal vein, is variable in location. Unlike the saphenofemoral junction, which is located 3.5 centimeters below and lateral to the pubic tubercle, the saphenopopliteal vein can be located anywhere within the popliteal fossa. So it can be located in the lower end of the popliteal fossa, the upper end of the popliteal fossa, or the mid portion of the popliteal fossa. is variable in its location within the popliteal fossa, but of course it cannot extend beyond the popliteal fossa. So this makes identification of small saphenous vein varicosities or sapheno-popliteal junction incompetence very difficult, because its location is so variable. So diagnosis of sapheno-popliteal incompetence by Doppler and managing it surgically is little difficult when compared to a saphenofemoral junction incompetence. Okay. So these are the basic points regarding the course of the two most important superficial veins of the lower limb. Now these veins have their own branches. So you have the great saphenous vein, which has the following branches. It has you cannot call it a branch, you can call it a distributary. So you find that you have draining veins, veins which drain into it, which are called communicating veins. So these communicating veins can be anterior accessory saphenous vein, posterior accessory saphenous vein. You have posterior branch of it. You have the anterior branch of the saphenous vein. The long saphenous vein and the short saphenous vein, you find that they have a lot of draining communicating veins. So the two most important communicating veins are the anterior accessory saphenous vein, which drains into the great saphenous vein, posterior accessory saphenous vein. With regard to the short saphenous vein, the most important communicating vein is the gastrocnemius vein. Now, like I said earlier, other than the superficial veins, you have perforator veins. So what are these perforator veins? The perforator veins connect the superficial to the deep veins. The flow of blood is always from the superficial veins to the deep veins, because you find that the deep veins tend to have a lower resistance lower pressures when compared to the superficial veins, and there is an intervening valve between them. So this valve ensures that there is only unidirectional flow of blood from the superficial to the deep vein. So other than the perforator veins, you also have communicating veins, like I said earlier. So these are anastomotic veins which would connect to superficial veins. So they are generally located within the subcutaneous plane. They do not penetrate the deep fascia, unlike the perforator veins which penetrates the deep fascia to drain into the deep veins. Communicating veins do not penetrate the deep fascia. There are two important communicating veins, named communicating veins, which play a very important role as far as varicose veins are concerned. So one of it is the long communicating vein between the great saphenous vein and the short saphenous vein. It's called the communicating vein of Giacometti-Cruvellea. So this communicating vein of Giacometti-Cruvellea connects the great saphenous vein with the short saphenous vein. Another important communicating vein is the anterior accessory great saphenous vein.